Hi everyone. So today the topic is in regards to the hip joint and why we suggest you should actually incorporate mobilization and treatment of the what we call the socket part of the hip joint, so the ilium, before you do stretching and strengthening to the hip, so the ball part of the hip joint. Now, this video is going to go through two parts. One is just a quick anatomy and how strengthening exercise works, so then you can understand the context of when the original topic of the video of working the ilium before the hip joint. So now, in all aspect of hip rehabilitation, there's one thing that you have to do really well. All right, so the primary reason for a hip to have injury is that the hip, so part ball and socket joint, is not spinning and moving within the center of the socket. So there is usually compressive force, all right, and there's shearing that happens. Now, if you stretch out the hip, the ball, without addressing the acetabulum, the socket, then you might get actually more shearing. Because now, instead of a one-side shearing, you stretch it out, then you have now a multiple plane of motion, degree of motion, shearing. So that's that. Now you have compressive because you don't have good muscle motor coordination or muscle strength awareness, then you have compression to that. So that's pretty much arthritis or instability or a labral issue that might be also bucket in with hip impingement. Now, when you strengthen a muscle influences bone and the way the joint moves. So if you're strengthening hip flexor because it attaches to the femur, then when you strengthen it and you do a movement like this, what happens is the head shifts forward. All right, so that's fine and that's normal. However, if you have imbalance and you have weak glutes or muscles to help shift the back, because the muscles in the back, the glutes, help to extend and shift the femoral head back. So there's this tug and war back and forth, but because if it's balanced and there's coordination behind it, there's not a forward back, it's a equal movement of forward back, so it stays centered in the socket. Does that make sense? So most of the time there's a lot of shifting forward because we are over dominant in the front and we have underdeveloped back, so there's imbalance. You stretch that out, then without proper strengthening, then you actually get more motion that goes in the front. Now you got more motion I'm talking about. You don't have a equal pulling back. So you have more motion, and so it just shears back and forth. Okay? However, if you have good coordinated and proper strength in the hip extensors along with the hip flexors, now this is the second part of the video. And if you don't address this, then you can still get compressive shearing force. And the logic is that, so we're going to talk about so this is good healthy hip, we'll say, because that's pretty much good, a room where I could put my finger in all directions, okay? So that's good. Now I could make this healthy ball position to have more high pressure compressive load by changing the pelvis. So if I bring the pelvis forward in an anterior pelvic tilt, that's a fancy word, context for you, it's the position where if you have too much curve to your low back, or it feels like when you're standing and you're looking at a picture of yourself, your butt is out more. Right? So if this is a good healthy position of the hip, I have a lot of room for my finger to move. If I bring this pelvis forward, obviously I can't do a good job because this is a model. You can see, and I'm really trying so I can show you, you can see how there's not a lot of room in the front. so you feel tightness here, you feel this jamming tension, and so you stretch out your hip flexors more, thinking like, oh, I can stretch it out. But if you don't address this, then guess what's gonna happen? Then you're actually making this more mobile, and it was just gonna go into a high pressure system in the front, and that's where a lot of people have tension points. So that's the impingement in the front. However, if you're here and you address the ilium first, you reposition it, you address the spinal and pelvis component of it, now you can see I don't even need to do anything to the hip. So there's two typical scenarios. One is you address the ilium first and then everything goes away. Then you don't need to be aggressive at the hip. Second is if you address the ilium first, right, and then you still have tension, then it's appropriate to do some stretching, smart mobilization to the hip. And actually you realize that you don't have to do a lot. Then actually there's a third. Both of those don't work, and that's where there's a small percentage that actually will benefit from more aggressive treatment strategies. Alright, but most of the time, 99.9%, you address that, then even with a diagnosis of hip arthritis, you can still get better. Alright, so that is why I would suggest addressing the ilium first, the pelvis first, and then doing hip stuff second. Please share this video. Let people know, especially if you know anyone that's doing yoga and still having pain. If they're a gymnast, if they exercise a lot, if they do CrossFit, or they sit a lot and they're doing the stretching or the rehab exercise and still having pain. It's because this is a big majority component of it. Alright? And if that doesn't work, then what we say, the organs have priority over the hip. So as I'm putting back the sigmoid colon, if that doesn't work, there's something that's next to it that impacts it. So the organ system. Here's something else for you to consider. Bye.